Professor Mathieu, you're obviously very passionate about the improved management of type 2 diabetes, and fundamental to that is changing patients' behaviours. Yet over the years, other groups have said the same thing, but the delivery has been difficult. What are your principles for changing people's behaviour?
I'm a big believer that if people understand their disease, that they will see solutions for themselves. Just saying to a person, you need to eat differently, you need to move, you need to take these pills, you need to inject this, will not convince the person. It's only when he or she will understand what is happening that they will see the light. There's a lot of discussion, for instance, whether self-measured blood glucose or even the newer technologies like the sensors are of any value in people with type 2 diabetes. I would say no to adapt the treatment, except when you're using insulin. But they can be such a motivational tool to the patient. I mean, I have people with type 2 diabetes carrying a sensor come to me and say, oh, when I eat a piece of cake, I see my glucose levels go up. Now I know I need to eat half a piece of cake. So how will it now be different? It's a progressive phase. When we look at outcomes in the last 5 to 10 years in people with type 2 diabetes, we do see mortality through cardiovascular disease go down. The only thing where we're bad at is the end-stage renal disease. But all the others, the outcomes are improving. I'm a big believer that if patients get it, if they understand what's happening, they will engage.
And are there practical steps that you would recommend to delegates attending this conference that they should follow when confronted with a patient with type 2 diabetes?
Yes, I think it's very important to, at the beginning of the disease, the first time you see a patient, already discuss with him what it will mean, this journey he will have with you, because it will be a journey of many, many years. Second, organize yourself in such a way that you can deliver structured care. So don't rely on the patient to make an appointment to come and see you. Agree with him or her that you will see him every 3 months and give them an appointment. Give them a recall if they don't show up. So it's really chronic disease management. It's integrated management of a chronic disease. So the practical steps is really get your patient on board, get him in the team, and make this management plan where you explain what this disease is so that they understand what it is and really engage in their treatment.
So it's actually quite hard work, both for the patient and for the physician.
Most patients nowadays know something about diabetes. I remember 30 years ago when I started off, when I needed to explain what diabetes was, they didn't know what it was. But now everybody knows somebody with diabetes. They have a family member, they have a friend, they have a neighbor. And so they know about this disease. Very often they know all the bad things about the disease. So in many cases, again, explaining to them what it is brings a rest to the patient, because they realize, oh, if I engage, if I start to live more healthily, if I start to move, if I start to eat less, if I can lose some weight, if I take my pills, I can live a good life. We often use examples of movie stars and other celebrities to show them that indeed, if you treat yourself well, if you engage in your therapy, you can live a good and long life with diabetes.
Professor Mathieu, thank you very much indeed for spending this time with us.
My pleasure.